It's Dr. Puri from Intelligent Health Group. So excited that you're here with us again as we begin our second time around on YouTube. Um, our last time was very rewarding in terms of getting so many comments back about the effects of motor vehicle accidents on people. And again, as I had mentioned, it's one of our most challenging things to deal with people who have been in motor vehicle accidents because there's so much layers of trauma, physical and emotional, to somebody who's been impacted in that way. Equally, one of the hardest things to treat and that brings the most tears to people's eyes, I know, when they come into our office, is pinched nerves. A pinched nerve is very painful. It's exactly what it sounds like. A nerve can be very sensitive. So imagine just it getting choked off or compressed. It can be very excruciating. It brings, the most stoic of people to tears. And it's been very challenging, when we see those sorts of patients coming into our office. I know when I first began practice 22 years ago, it was definitely eye-opening seeing those type of patients walking into my office, and I had to do everything I could to try and remove pain. It was very difficult. I wasn't overly successful in the beginning at these sorts of things, but luckily, with the power of chiropractic, people would slowly heal. That's the benefit of chiropractic. It's not so much the practitioner, it's the science. It works. It's like a law. When you simply remove what's putting pressure on that nerve and relieve the tension on that area, the area is going to heal. So that's what an adjustment does. A chiropractic adjustment is very specialized in terms of removing the tension and stress on the nerve and immediately restoring function. But again, to get the relief that one wants and lasting relief, it takes time, like anything. Because once you pinch a nerve, it causes something called hypoxia. Hypoxia is when there's lack of oxygen to the nerve. When there's lack of oxygen to the nerve because it's being compressed on by a structure, the nerve dies. And it takes 1 to 2 square millimeters, 1 to 2 millimeters a year is the actual regeneration rate of nerves. So it's very slow. In fact, we always say it's better to have broken a bone, which heals in 6 weeks, or even tear a muscle or get a muscle injury, than it is to actually get nerve damage. Nerve damage is very slow going and healing. But luckily, we know now that nerves do regenerate. It just takes time. But the things that you can do, whether it be chiropractic and so forth, like we have in our office, will definitely speed that up and ensure a positive outcome. So let's start talking a little bit more about pinched nerves in detail. What are pinched nerves, first of all? So we have so many nerves in our body, as you can imagine. Obviously, as chiropractors, our primary focus is spinal nerves, the nerves that exit the spine, the spinal column, and go and give power and innervation to all the major organs of the body. But those spinal nerves, they do branch out and become peripheral nerves. They become nerves that travel throughout the body as well, the different branches, and again, plug into different organ systems, the muscles, the skin, and so forth. So a pinched nerve can happen either at the spine level, or it can happen in one of the branches, what we call the peripheral nerves. And this leads to what we call two types of pinched nerves. One is something where a condition called radiculopathy comes into play. Radiculopathy is when the actual nerve root from the spinal nerve, gets trapped. That's called a radiculopathy. The symptoms of radiculopathy are very painful, such as sharp shooting pain, weakness, numbness in the legs, tingling even. You definitely get your reflexes get reduced, and your sensation goes off. You definitely get less sensation in that part of the body where that nerve goes to. Like, for example, the most famous being sciatica. Sciatica is the longest nerve of the body. It exits our spine and goes and travels down our whole leg. So when you get a pinch in our lower back, at the spine level, and it chokes off the nerve supply of that sciatica or sciatic nerve, you get the condition called sciatica, which is where you have the sharp shooting pain, burning, tingling, numbness down your leg. The sciatic nerve travels from the lower back, down the buttock, down the back of the leg, right to the foot. So if it's trapped anywhere, you're going to get all of those sorts of sensations. And that's the testing mechanism we use in the office to determine if it's sciatica, is to see if it's actually that limb has gone weak, reflexes have reduced, or the sensation has gone off. That tells us there's a radiculopathy. The nerve's actually getting compressed at the spine level. The other type of pinch then being where the peripheral nerve or the branch gets entrapped by a structure that nerve is under. Most commonly that in that situation would be a muscle or potentially a joint structure, but most commonly a muscle. When that gets really tight or inflamed, it puts pressure on that nerve as it's traveling through one of the limbs, like the arms or legs or so forth. And that's called a peripheral neuropathy. In that case, your sensation could be different, but usually the reflexes, your strength even isn't as affected as it would be with a radiculopathy. And that's how you can kind of tell the difference, okay? And just the distribution of the pain is a bit different. With true sciatica from the lower back, you're getting it from that lower back all the way down to the foot. With a peripheral entrapment, sometimes it doesn't come down the whole leg. It comes down part way or in and around that area where it's being pinched. So in sciatica, for example, one of the most common peripheral entrapments of that sciatic nerve is called piriformis syndrome. Piriformis is that muscle that's in your glutes. It's in the buttock. So as that nerve travels out of the spine, the sciatic nerve travels out of the spine, travels down through the buttock. That muscle there is called a piriformis muscle. When that gets really tight and compresses that nerve right there at that level, you can get tingling, numbness down the back of the leg, right to the knee. But most commonly then it won't go beyond the knee. And that's how you know, again, the difference between the peripheral entrapment of the sciatic nerve versus the radicular entrapment. So pinch nerves, again, very painful. We've talked about how we differentiate the two types of pinch nerves. But now let's get into what we can do about it. And this is, again, where the beauty is. And what gives us so much pleasure and delight nowadays is that we have so much more we can do for nerves and nerve pain than we did originally when, like I said, when I first graduated. We have very specialized modalities to unpinch nerves. So what does that look like? Well, if it's a radicular issue, if there's compression at the spine level, that nerve might be being compressed because the joints are locked out of alignment. And then we would definitely want to be adjusting that spine and unlocking that area, taking pressure off the nerve. Or sometimes the disc, the space between the vertebrae, that cushioned material can actually bulge out, put pressure on the nerves, and then you get the sharp shooting pain down the leg. That's definitely a radicular pain caused by a disc bulge, herniation, or prolapse. Again, these are common. With that, what we do is we have specialized technology in our office. It's called spinal decompression therapy. It's an amazing table. You lie on that table. It's a computerized device. We buckle you in, and the spine actually stretches apart, taking pressure off the discs and relieving tension on your nerves. That's a great way of unpinching things. And again, if that doesn't unpinch it, then surgery is the only option. So suffice to say, with spinal decompression, 80% of the cases are resolved, maybe even 85%, and you rarely will need surgery if you're undergoing that type of treatment. It's the gold standard in relieving nerve pinches from the spine when it comes to those originating in our lower back or the lumbar spine, with sciatic nerve being the most common of them of all. The other way that we can unpinch nerves, especially if it's a peripheral entrapment, is through what we call active release therapies, things to actually reduce the tension on the muscles themselves that are pinching the nerve. We also have, so there are special massage techniques we can use. We have specific physiotherapy devices and exercises you can do as well to help alleviate symptoms. But the best thing we have is something called class 4 laser or laser treatments. Laser treatments are visible light, infrared light, and near infrared light. We shine that into the muscle. That actually heats things up from the inside. It stimulates the cell repair and the metabolism of the cells, and you get rejuvenation. Things to start coming back online. The nerve inflammation comes down, the muscles relax, tension comes off the nerves, and there you go, voila, you have an unpinched peripheral nerve. So that's quite amazing to see in our office how the tension just melts away under the laser. There's no side effects from the laser. It simply is these forms of light, and it's like magic. We call it the magic wand in our office. So you have your decompression therapies, you have your laser treatments, you have manual work you can do through massages, etc., to release nerves. And for the most part, those things will be enough. Remember, we have 3 stages that we go through in our signature system of approach when we deal with pain. The first thing is when people come in, we reduce inflammation, reducing that bit of illness and inflammation. Then we start taking you through different stages of healing. So that will look like various improvements in function. We start with flexibility, gain some strengthening, then we stabilize you. Then we just maintain you after that to make sure the problem doesn't come back. This can happen in as little as 90 days, where you can help unpinch nerves and actually stabilize the condition. So we have a great success rate with these sorts of conditions for sure. If you have any questions about pinched nerves, or you're not sure if something is a pinched nerve or not, do come in. I would say pinched nerves aren't as common as people actually say. Usually people come in telling us they have a pinched nerve. Then we check and we see that they don't. Usually it's just a pressure on the nerve versus a pinch. Now it's very important you know the difference. Pressure on a nerve would happen from a subluxation, when a joint locks out of alignment because of stress buildup in our body, whether it be physical stress, emotional, or chemical. Cortisol increases, which is a stress hormone. Our muscles tighten up, our joints lock out of alignment, and that puts irritation on that nerve, some pressure. That's what we adjust for, and it releases. So sometimes it's bad enough that it feels really like a bad pain, a sharp pain, and people call it a pinched nerve, but it's not. Unless you actually don't have those signs that I just talked about, where once we assess you, literally your motor strength is reduced, your reflexes are reduced, your sensations reduced, you have that tingling and numbness, you have that sign, the sensation is different now or altered. That's how we would know it's a pinched nerve versus just pressure. With the pressure, you wouldn't get any of those other things, okay? A pressure thing is really easy to fix. The pinch, the true pinch, where the nerve itself gets inflamed then, is longer. But regardless, needless to say, there's treatments available. And so I want to invite you, if you think you have a pinched nerve, or you simply want to get checked for one, or you know you have one and you want to find a proper gold standard solution, just give us a call. Call us at 647-499-1444. Press the extension of the clinic you want to go to. Or email us at info@intelligenthealthgroup.ca with your questions. We'd be happy to answer them. But do come in. This month, we are giving away our $49 complete assessment, report of findings, and first treatment for just $49, whether it be for physiotherapy or chiropractic, or even acupuncture. So all of these disciplines are great at solving your nerve issues. And collectively, we have a signature system for pinched nerves. So do come in, do reach out. Let's get you checked. We look forward to serving you. And until next time, I'm Dr. Vikas Puri. Thank you.